Welcome to the Endo Kids podcast, the podcast where we help families navigate the ups and downs and in-betweens of growing up healthy. I'm Dr. Rinka Mera, the founder of Endo Kids Concierge and a pediatric endocrinologist. And my co-host is Dr. Lindsey Waldman, who is also a board-certified pediatric endocrinologist. We are here to break down the science of hormones, share real stories, answer the questions parents wonder about the most. So whether you're worried about growth, puberty, thyroid, or just want to understand your child's development a little bit better, you're in the right place. We believe every family deserves answers, support, and a caring partner in their health journey. So grab a cup of coffee, get comfortable, and let's tackle this topic together today. This podcast is for educational purposes only and is not a substitute for medical advice. Please consult your child's healthcare provider for individualized care.
Hello and welcome to the Endo Kids podcast. My name is Dr. Lindsey Waldman. I am a pediatric endocrinologist, and I am thrilled today to be joined by not only a very good friend, but an amazing physician. We are so lucky to have Dr. Rachel Casey. She is the section chief for pediatric and adolescent gynecology at Inova Health, which is located in Northern Virginia. She also holds leadership in the American College of Obstetrics and Gynecology, as well as the North American Society for Pediatric and Adolescent Gynecology. She started off in New Orleans and then came up to DC for medical school at George Washington, where she stayed for residency and then fellowship at MedStar, which is also located in Washington, DC. Rachel, thank you so much for joining us for this conversation. We're really excited to have you. And as we start, tell us a little bit about yourself, how you got into this field.
Yes, thanks, Lindsay. I'm so excited to be here and to see you. I love that you included that I am from New Orleans, Louisiana, because that is a big part of who I am. And it is a part of why I do what I do now. Grew up in Louisiana, and I would say from an education standpoint related to women's health, teen health was very minimal. And I would say that was the beginning of coming into pediatric and adolescent gynecology. So I'm an OBGYN. So I did my training in OBGYN, and then I did additional training in pediatric and adolescent gynecology. And so I work just with children and adolescents, as you know, because we have worked alongside each other before. And one of my favorite stories is talking about how I learned about puberty, which was in health class on Halloween by my PE teacher who was dressed as a witch. And that was a very memorable moment. And I also remember when I started my period in the Dallas airport when I was traveling with my dad. And I didn't tell him. I don't even remember telling my mom. So I love talking about puberty development in girls, menstrual cycles, what to be thinking about and wondering about so that it is not so foreign for the girls going through it right now.
And that is the most beautiful segue because that's exactly what we're going to be talking about today. I really wanted to talk to you about periods, what is normal, what is not normal. We can of course touch on puberty in girls, but really focusing on periods. I will say, giving some personal information, I have a daughter who is 11, and so this is a big topic of conversation with my friends and certainly something that I've talked about for years with patients. So I guess just starting at the very beginning, thinking about periods and thinking about what is normal for when girls start their period.
Yes, this is a great question. And one thing I always like to remind people is that getting to a period does include puberty, which I'm sure is talked about quite a bit on this podcast. And it takes once puberty starts, it takes about 1.5 to 2 years for the period to come. And there is a wide range of what we consider normal. And a normal age of starting a period is anywhere from 9 to 15 years old. The average age is still 12 and a half, but it is a pretty wide range for the period to start. It could be someone who's 9 in fourth grade or someone who's 15 in high school.
That is a really wide range. And using those numbers, what are some red flags? So is a girl getting her period at 8 or nothing still going on at 15? Do you consider that a red flag?
That is a great question. As in endocrinology, when you see the girls who start puberty a little too early, we like to intervene or learn about that before someone gets their period at age 8, because age 8 certainly is too early and not normal to start your period when you are 8. So again, it's those initial signs of puberty. But also to remember that even if that large range is 6 years, if you started puberty at 10 and you're 14 and haven't had your period, that's something that we should be thinking about. And when we use, I hate using the words like concern and red flags, but something that we should wonder about. So yes, if a girl has not started their period at age 15, it is something that you should ask why. The parents should be asking their pediatrician, why haven't I started my period? And it could be something that is normal for you, but it is definitely something that should be looked into. We like to talk about the menstrual cycle as a vital sign. So just like we check heart rate, blood pressure, the menstrual cycle is a sign of the inner workings and the inner health of someone's body. And that is why your pediatrician may ask you every time you see them, have you started your period and when was the last one?
I think that's a really great point. And I think using the term red flag, absolutely, you are correct. Thinking, questioning, finding out from the pediatrician and just looking into it, maybe starting with some blood work if that's what they feel you need, or visiting one of us, right? A pediatric endocrinologist or a pediatric gynecologist. I absolutely agree. Now, kind of moving down the road, once girls do start their periods, what is considered normal or typical as far as patterns, how often they get their periods, and how long they last? And I know this is a hard question.
Well, it's really a great question because initially it may be different. Initially it is very often different than it will be as the years goes on. So when girls get their very first period, it's common for them to be irregular. For some people, the first 2 or 3 periods may be spread apart. And then even over the next year and a half to 2 years, the periods may still continue to be irregular. Usually after about 1.5 to 2 years, they start to become more regular. And that regularity we're looking for is somewhere between 21 and 45 days. So here's another theme of a large range that may be considered normal or okay during that time, where it could be every 3 weeks, it could be every 6 weeks. And remembering that in that time frame, periods should not be lasting longer than 7 days. Most commonly, they're about 5 to 7 days. But sometimes in those early years when the periods might be coming every 21 days and someone's bleeding for 7 days, that's a lot. A lot of people worry about it. And we see a lot of girls, or I would say parents, who have concerns about the length of the period and frequency. But oftentimes it's actually normal where it's coming every 3 weeks, counting from the first day of the period to the first day of the next period. And then it should not be lasting longer than 7 days, which is why I think it is so important to help and support girls learn how to track their periods. Because listen, we have so many apps these days, and how often we have girls in the office with their apps. It is incredible what they're able to learn about their own bodies just by tracking their periods. And bringing that data to an appointment is so helpful.
Yes, it was not too long ago where we were like, oh, just mark it on your paper calendar and, the next month, mark it on your paper calendar. But I agree, there are so many wonderful apps out there. No need for those paper calendars unless you love them that can help to track them. And then, of course, bringing that information if you are concerned to the pediatrician or to the specialist appointment, because absolutely that is going to be one of the first things that we ask about, if we're talking about periods and if we're concerned.
And listening to some of the things you were just saying, as we talk about how often they're irregular and may start to become regular again, I would also mention that if they're regular and then become irregular, that is also something we should be asking why about. So most people may be irregular initially, but if you start and you're super regular, that is normal for you. But if something starts to change, we always want to ask why. If there's a change, we always want to ask why.
That's a great point. And when we talked about the duration, 7 days long at the most, a lot of people are concerned, families are concerned maybe about heavier periods. Is there a way that you define heavier periods? Again, for girls that are just starting, they don't know what a period is, quote, supposed to be.
Sure.
Any of us really know what is a period supposed to be. So when you're asking about heaviness, how are you asking about it? How do we kind of define it for girls and their families?
Yes. And that is such a hard thing to know because it's very subjective, meaning it's somebody's experience of it and questions that you're asking about it. But some of the questions that we do ask are how many days it's lasting. So it really should not be lasting longer than 7 days. We often ask how many products somebody's going through a day, whether it's a pad or tampon. And we usually think if it's more than six, that's on the heavier side. We also ask about blood clots in the blood that's passed. And if it's larger than a quarter, that may signify that that's heavier than we would expect. And then also how quickly they might be soaking through something. If somebody's using a super product, a level 6 pad, and they're soaking through in 1 to 2 hours, having accidents at school, that is certainly too heavy. And then I always like to say, you know, there's the medical aspect of it where we're thinking through, are your periods so heavy that your blood count is low, that you're losing too much blood? And there's also the experience of the teenager where maybe your blood count is normal, but you are struggling at school because you can't stay on top of your period. Well, then that's another reason that maybe we need to intervene because the experience of the period is not an acceptable way to live.
Tell me how you talk to your patients when they're coming in talking about painful periods or cramps.
Yes. And thankfully, times have changed. Thankfully, I have a beautiful soapbox I like to stand on and talk about this. It's time we're listening to women more and more, including young girls. And to your point of the experience, somebody's experience of pain is their own. You can't say whether or not it's too much pain or not, right? So if somebody's coming and they're saying, I'm having a problem with this pain, then we need to address it and figure out how to make it better. I would not say period cramps are normal per se. There are many girls who do not have any pain at all and do not have cramps at all. There are many girls who may have some mild cramps that are manageable with a heating pad or maybe one tablet of ibuprofen. And then there are girls who are having to call home, having to leave school. There are girls who are not able to get out of bed. There are girls who are throwing up or passing out because the pain is so severe. And it's if your period is impacting your ability to live life or impact in any way, school, family functions, family vacations, just enjoying your summer, then it's something that we can address.
I think that's a really important point. And again, not necessarily something that we heard when we were growing up, but luckily, like you said, times have changed. And there's a lot of things out there that we can do to help these girls and families make sure that they can live life and not have to be worrying about their period 24/7 during that week. What are some things that we can offer these families and girls?
Yes. And before we get into that, I'm going to mention briefly about the pain and the trajectory, as we've talked about, of how things may have been 20 years ago. And I would say one of the most common scenarios I see in my office is a woman, a mother with her teenage girl. And the mom had this horrible history of pain with her periods, eventually diagnosed with endometriosis, but spent many, many years just suffering and kind of told to like, you'll get through this, it's okay. Or it's in your head, it's not exactly what you think, or that kind of thing. And they're bringing their daughters in because they want to make sure that they don't go through what they went through. And so, adjusting to having a period at all, there may be cramps, right? The uterus is mostly made of muscle. The uterine contraction, it can cause discomfort and pain. And most of the time with that, things like heating pads, ibuprofen, the class of medications like ibuprofen, Motrin are very, very helpful. I always tell girls to try different things because everyone is different. Like if Pamprin works for you or if Midol works for you, that is okay. When we look at the things that we start with, it's usually the class of NSAIDs or nonsteroidal anti-inflammatories like ibuprofen. Sometimes we use Aleve or naproxen, and we can use those in prescription strength doses. And most of the time for that, that is sufficient, I would say.
The medication is there. And for families not to be scared about using it, really, these girls should not be suffering. And so if you have tried the heating pads, if you have tried warm showers, baths, and stretching, please let them try those medications found over the counter. Once those don't work, again, talking to your pediatrician or visiting a specialist such as one of us can really help in that way, kind of give you some different ideas and different options. Because just like you said, no one needs to suffer. There is absolutely no reason for that. And since we're on talking about treatments, let's talk about, what if the periods are super abnormal? We talked about earlier about what is considered normal as far as duration of period and how frequent you're getting it. But what if you find that, you are not in that normal category after, a good year or two of having periods? What are some options that you talk about with families?
Yeah, and I think that's a great question. We can talk about the answer to that in both the regularity of the periods and the pain or the flow, right? And so, usually, once girls are a year and a half to 2 years from the very first period, if there's still some irregularity, if they're missing every other month, or if something has changed again, maybe they were every 28 days and now they're coming every 17 days. We always want to ask why. Again, the menstrual cycle is a vital sign. So when we try to think through what kind of treatment we might use, we want to understand the why of that happening. And much of the time, it is related to kind of that, the communication system of the brain to the ovaries trying to learn. But there are other conditions that can certainly cause periods to become irregular. And those are things we can test for in lab work usually. And we don't want to overlook them because then that will help guide how we're going to manage things over time.
I think that's a great point. So again, like you said, trying to figure out if there is a reason behind those abnormalities, starting with that blood work. And then sometimes also thinking about an ultrasound, just something on the belly. Sometimes we do that as well to kind of figure out what might be going on. Certainly not always. And then from there, kind of figuring out what is the best treatment plan, right? Are there medications or something else that we might need to help these girls? When you have those conversations, you get to that point, you've done the blood work, maybe an ultrasound, maybe you found something, maybe you haven't. What are some of the treatment options that you talk about?
So again, when we circle back to the why, we try to kind of understand the why of it, right? So if we're working through irregularity, sometimes we do labs and we find out the cause. I will say the most common cause of irregular periods in women, generally speaking, is the condition formerly known as PCOS, now known as PMOS, polyendocrine metabolic ovarian syndrome. And that's still a very, very common cause of irregular periods in young girls. And once we understand the why of it, then we can figure out how to manage that, right? And a lot of the times it's education, learning, what are we doing? What are you doing with your body? And supporting any changes that might make sense for this girl and her family. And then what I try to do when we treat these kinds of things is focus in on what is most bothersome in this condition. Like we have the labs. If you have high cholesterol, we can treat that. If you have, a thyroid condition, we can treat that. But for things like if the period is every 6 weeks and you're totally fine and nothing's bothering you and you just want to understand why, then we don't need to do any medication, right? If your periods are irregular and it's completely stressful, you have PMOS and you're having a really bad like hair growth on your chin and stuff, there are medications that we can use to treat that, right? So medications that are traditionally invented for birth control, I like to call them period pills. These are medications that can help change that hormonal balance, slow down hair growth, regulate period. And for some people that is can be really life changing.
I agree. I have absolutely seen girls, really improve once starting these period pills. Things happen more regularly. A lot of times their periods might get lighter if they were heavy to begin with, and they just become much more comfortable knowing when their period is going to come. So it really can be a huge improvement for them. And as we think about starting to kind of wrap up this conversation, what are some tips and tricks you have for families talking about periods, dealing with periods? I will say for me, one of the most exciting things I've seen is the period underwear and bathing suits that are now out there for teens and adults, of course, daughter.
Yeah, I mean, I think that honestly, the most important thing is having the open conversation, even before that happens, helping your child to feel prepared, right? When they hear you talk about it and they can feel comfortable coming to you to ask the questions, that's a huge piece of this. So, educating yourself, taking the time to talk to your child about it. I think the preparation is key, right? Making a little period pack for the backpack that includes, pads are good. Some people hate them. They are uncomfortable if you've never used them before, right? There's a variety of different period underwears available with different levels of heaviness that you can reuse, environmentally friendly, right? So having that, something in the backpack. I know other things people put in their little period packs are maybe like a wipe and just having that, I think, honestly, is going to help girls feel really prepared. And in some ways, might make the parents feel better. Another funny question that often comes up, because sometimes I give these puberty sessions, is like, what do I do if I get my period in school? Right. And that happens. Right. And we always talk through like how can you communicate that to your teacher? What if it's like your male PE teacher and you don't want to tell him? You go up to him and you say, I need to go to the nurse's office. It's a girl thing. And I promise you, he will know what you're talking about. That's all normal.
I think that's a great point. I also like to tell families about one specific book, and I know there's a lot out there, but The Care and Keeping of You, which is put out by the American Girl Doll Company, and you can find it anywhere. I think it's a great jumping off point. Sometimes families just need a place to start the conversation, even when they're just talking about puberty, but talking about periods and everything else. I think it's a great thing to read together as a jumping off point to inspire some more conversation and kind of open the conversation about it. Periods go.
Yes. I would say most of the time things go perfectly fine. Most of the time it's a learning curve and it's figured out. Sometimes things do not go as planned. And this is why we exist in our specialties. And that is why it's so important to have these conversations with your girls so they'll come tell you if something is not right. Especially the things that I usually tell girls, which we've kind of touched on, is if your period is too painful or too heavy, you have to tell your parent. Like you have to tell somebody because sometimes there might be something else going on that we need to uncover. So just like I'm just happy to always have this conversation and happy to support parents talking to their kids about it. uh, and just knowing that most of the time it's going to be okay. And if not, there's people like us.
Absolutely. And if families want to reach out to you with questions for an appointment, maybe to set up a talk about puberty in their community, where can they find you?
Yes. So right now I'm on Instagram is probably the easiest way to find me. And I'm Dr. Rachel, RACHEL_KC. And that is my handle. Website soon to be coming.
Thank you so much for joining us for this great conversation. This has been really, really informative, and I think our listeners will really enjoy it. And to our listeners, thank you so much for listening to this. You can always find more information on endokidsconcierge.com. Please don't hesitate to contact us with your questions for an appointment in the Northern Virginia area. Thank you so much for joining us, and we'll see you again soon. Bye. Thanks. Thank you so much for joining us on the Endo Kids podcast. We hope you're leaving with a little more knowledge and a lot more confidence. If you have questions, stories, or topics you'd love us to cover, please send them our way. We love hearing from you. And don't forget to check out our website, www.endokidsconcierge.com, for free resources, guides, and more ways to connect. You're not alone on this journey. We're here to support you and your family every step of the way. If you enjoyed this episode, don't forget to subscribe to our podcast so you never miss an update.